Have you ever wondered what factors could increase your risk of developing breast cancer? It's a question worth pondering, as gaining knowledge about these factors can play a pivotal role in safeguarding your health. Breast cancer risk factors fall into two main categories: modifiable and non-modifiable. Modifiable risk factors are those elements in our lives that we can change or control through lifestyle choices or medical interventions. This could be anything from our diet and exercise habits to our alcohol consumption. On the other hand, non-modifiable risk factors are those aspects that remain constant and are beyond our control. These include factors like our age, genetic makeup, and family history of breast cancer. By understanding the difference between these two categories and the specific risk factors that fall under each, we can better comprehend our individual risk profiles. So, let's start by exploring modifiable risk factors. Modifiable risk factors are those that we can change through lifestyle choices or medical interventions. These factors play a significant role in our overall health and specifically our risk of developing breast cancer. First off, physical activity. Regular exercise not only boosts our overall health but also helps maintain a healthy weight, which is crucial in lowering breast cancer risk. Try to incorporate different types of activities like walking, swimming, or even dancing into your routine. Next up, diet. What we eat matters. A diet rich in plant-based foods and low in saturated fats can potentially lower the risk of breast cancer. So remember to fill your plate with colorful fruits, veggies, whole grains, and lean proteins. Alcohol consumption is another modifiable risk factor. It's simple. Reducing or completely avoiding alcohol can lower breast cancer risk. If you do choose to drink, try to limit it to no more than one drink a day. Body weight is a crucial factor too. Maintaining a healthy weight, especially after menopause, can significantly reduce the risk of breast cancer. This is because excess fat tissue can increase estrogen levels, which can in turn raise breast cancer risk. Let's talk about hormone replacement therapy, or HRT. While it can help with menopausal symptoms, long-term use or use of high-dose HRT can increase the risk. So it's advised to use it for the shortest time possible and at the lowest effective dose. Lastly, hormonal birth control methods. Some of these methods may slightly raise the risk of breast cancer, but the good news is the risk goes back down over time once the use is stopped. Now that we have understood modifiable risk factors, let's move on to non-modifiable risk factors. Non-modifiable risk factors are those that we cannot change or control. These are the aspects of our life that we simply can't alter, but knowing about them can still be beneficial in our understanding of breast cancer risk. First up is age. The risk of developing breast cancer tends to increase as we grow older. Most cases are found in women over the age of 55. However, this doesn't mean younger women are immune. It's just a reminder that vigilance should increase with age. Family history is another factor. If you have a close relative, such as a mother, sister, or daughter who has had breast cancer, your risk may be higher. This doesn't mean breast cancer is inevitable, but it might mean you'll want to start screenings earlier or more frequently. Our menstrual and reproductive history can also play a part. Factors like beginning your period at an early age or going through menopause later can increase risk. This is due to longer exposure to estrogen and progesterone, hormones that can stimulate certain types of breast cancer. Genetic factors are another piece of the puzzle. Certain gene mutations like BRCA1 and BRCA2 significantly increase the risk of breast cancer. If these mutations run in your family, you may want to consider genetic testing. Lastly, having dense breast tissue can raise your risk. Dense breasts have more connective tissue than fatty tissue, which can sometimes make it harder to spot cancers on mammograms. With a grasp on the risk factors, let's now explore prevention strategies. Prevention strategies are actions we can take to reduce our risk of developing breast cancer. Let's explore some of these strategies. First, maintaining a healthy weight is crucial. Excess weight, particularly after menopause, can increase the risk of breast cancer. Regular physical activity can help keep your weight in check and lower your risk. Next, let's talk about alcohol. It's best to limit alcohol consumption, or better yet, avoid it altogether. Even modest amounts of alcohol can increase breast cancer risk. A balanced diet is another important factor. We should emphasize fruits, vegetables, and whole grains in our meals while limiting saturated fats. Some studies suggest that diets rich in these foods can lower breast cancer risk. Hormone replacement therapy, or HRT, is often used to manage menopause symptoms, but it's best to limit its use. If you must use HRT, consider the lowest effective dose for the shortest duration possible. Also, consider alternatives to hormonal birth control. Some birth control methods can increase breast cancer risk, though the risk decreases after stopping use. Discuss other options with your healthcare provider. Breastfeeding children, if possible, can also reduce your risk. Studies show that women who breastfeed their children have a slightly lower risk of breast cancer compared to women who have children but do not breastfeed. Now, let's not forget about our family history. Stay informed about your family's breast cancer history, as having a close relative with breast cancer can increase your risk. Finally, regular screening is key. Follow recommended guidelines for mammography and other tests. Early detection can make a significant difference in the outcome of breast cancer treatment. These strategies can help in reducing the risk of breast cancer. Remember, prevention is always better than cure. It's about taking steps today that can make a difference in your future. Every action counts, no matter how small it may seem. Understanding breast cancer risk factors and prevention strategies is a proactive step towards reducing the risk. We've explored modifiable and non-modifiable factors and prevention strategies, from maintaining a healthy weight to regular screening. By staying informed and making conscious lifestyle choices, you can significantly influence your health. Knowledge is power, and with this power, we can face breast cancer head-on. Thank you for watching this video. Remember to like, share, and subscribe for more informative content.